Hello everyone, and welcome. In today's guide, we're going to talk about fundoscopy and why it is very important in neurology. Many people think that fundoscopy is only related to eye problems, but in reality, it can also give doctors valuable information about the brain and nervous system. Because the eye is closely connected to the brain through the optic nerve, examining the back of the eye can sometimes reveal early signs of neurological conditions. Fundoscopy is a simple clinical examination where a doctor or medical student uses a small instrument called an ophthalmoscope to look inside the eye. This device shines a light through the pupil and allows the examiner to see important structures at the back of the eye, such as the retina, optic disc, and blood vessels. These structures can provide important clues about what might be happening inside the brain. Before starting the examination, it is important to explain the procedure to the patient in a calm and friendly way. For example, you can say, "I'm going to examine the back of your eyes using this small light. It may feel a little bright, but it will only take a few moments." This helps the patient feel comfortable and understand what is about to happen. Next, the ophthalmoscope is turned on and adjusted to the correct focus using the dial. Sometimes a positive lens setting may be used to briefly examine the front surface of the eye, and then the dial is usually returned to 0 to properly observe the red reflex. The red reflex is an important initial finding because it confirms that the light is passing correctly through the eye. After that, the examiner asks the patient to look at a distant point, such as a spot on the wall or a light switch. This helps keep the eye steady and allows a clearer view inside the eye. The examiner then slowly moves closer while keeping the ophthalmoscope aligned with the patient's pupil. It is also helpful to gently place a hand on the patient's shoulder so that both the examiner and the patient remain stable and avoid accidental movement. Once close enough, the examiner carefully looks through the ophthalmoscope to observe the optic disc, retinal blood vessels, and surrounding retina. In neurology, this step is very important. For example, swelling of the optic disc, known as papilledema, can suggest increased intracranial pressure, which may occur in conditions such as brain tumors, bleeding in the brain, or severe head injury. Similarly, changes in the retinal blood vessels can sometimes indicate stroke, hypertension, or other neurological problems. After completing the examination in one eye, the same process is repeated for the other eye to ensure a full assessment. Throughout the procedure, it is important to keep communicating with the patient and reassure them that the examination will be quick. Finally, once the examination is complete, the examiner should thank the patient and close the interaction politely by saying something like, "That's the end of the examination. Thank you for your cooperation. Do you have any questions?" In summary, fundoscopy is a quick, safe, and extremely valuable examination. It not only helps detect eye diseases but also provides important insights into neurological conditions, making it an essential skill in clinical practice. Before you go, if you found this video helpful, make sure to hit the like button and subscribe to the channel for more simple and easy medical explanations like this. And don't forget to press the bell icon so you never miss our upcoming videos. Thank you for watching.